if we have a higher incidence of breast cancer in Western countries, and it's also true that we have a high-fat diet combined with refined sugar, what do you see in clinical studies with refined sugar and the replication of breast cancer cells?
So I think the direct connection is to the animal experiments that we're doing with variations in the kind of fatty acids in the diet. We have not shown that there's any difference in refined versus the unrefined sugars because of the way they're handled by the body. What there is a difference in is the amount of calories in foods that have a lot of refined sugars. And the common theme is calories because excess calories equals overweight and obesity. And so while it's very clear that content in the diet matters to some degree, probably the first goal is overall calorie restriction for us. What Western countries have in common is excess calories. For example, since we converted to a kind of fructose-based food system where the U.S. heavily fortifies all of our food production with corn sugars, which are fructose, the average daily caloric intake of Americans since the 1950s has gone up 15%. That may not shock you at first, but in physics, it has to go somewhere. And the only way you can take care of that extra 15% of calories per person per day is to imagine that we're more active or accept that we're overweight. And those are the only two places it can go. So for me, the question is a little bit less right now about the specifics and a lot about the totality of the calories. I want to be clear. I'm not saying that there couldn't be differences between the different foods and their impact. In fact, there surely are. But it's a little harder right now to tease that out when it's being overwhelmed by the excess of calories in total.